Hello guys, how are you all? Welcome back to MedSteps YouTube channel. So now we are in First Aid Series, that is microbiology. So today our topic is stains. So what it means? Whenever we are going to visit any doctor with like any infection, any problem, then they will tell we have to do culture. In that culture we have to do stains. So what it means whenever a patient has infection, the first question is what organism is causing that infection. So the first weapon we are using, that is staining. So staining is the one type of method to identify the microorganisms or bacteria. Okay, so stains is help us see organisms that are otherwise it's like invisible, because human can't see that microorganisms with our naked eye. So that's why we have to do staining, then after we have to find that organisms. Okay, so now gram stain. What is gram stain? The first line lab test for bacterial identification, we are doing gram stain. So this gram stain is divided into two types. One is gram positive, second one gram negative. So how we are dividing this thing means depends on peptidoglycan layer. Okay, so here, so in gram positive things we can see the cell wall will be like thick peptidoglycan, and the color after doing gram stain we can see like purple or violet color. Next one, gram negative. In this gram negative we can see thin peptidoglycan layer. That thing in color means, what color we can see means it's like pink or red in color. Okay, so what are the steps we have for doing gram stain means, first of all we have to do crystal violet dye, then after we have to do iodine, we have to add iodine, then after alcohol walls, then after we have to do counter stain, that is we have to use safranin. Okay, so these organisms, these bugs don't gram stain well. That means some organisms are there that gram stain is not enough to find out that organisms. So we have to do special stains, or special for finding that thing we have to do special stains, or we have one mnemonic to remember that organisms. That mnemonic is, these little microbes may unfortunately lack real color but are everywhere. So first one you can see like treponema and leptospira. This treponema and leptospira, the layer will be like too thin. Next one we can see Mycobacteria. The Mycobacteria we can see like high lipid cell wall. Next one Mycoplasma and Ureaplasma, that is like no cell wall. Next one Legionella. That Legionella will be like intracellular. The Rickettsia will be like intracellular. And we can see like Chlamydia, that is in Chlamydia we can't see any muramic acid. So less muramic acid we can see because it's lack of classic peptidoglycan because of decreasing or reduced or no muramic acid. Next one Bartonella. This is like Bartonella will be like poor staining, and Anaplasma or Ehrlichia, that is intracellular. If gram stain is negative or but infections are we are suspecting, then we have to do special stains. The stains now we are going to discuss. The special stain we can see like Giemsa stain. In Giemsa stain mostly we can see like intracellular and blood parasites. What does this Giemsa stain means? We can find out some organisms. We are using this thing in peripheral smear and intracellular organisms. So in mnemonic we can see like certain bugs really try my patients. So what are the organisms we can see means Chlamydia, Borrelia, Rickettsia, Trypanosomes and Plasmodium. Okay, so next one we can see like periodic acid Schiff stain. In periodic acid Schiff stain, also known as PAS stain. So what does PAS stain means? We can easily differentiate with glycogen, mucopolysaccharides and fungal cell walls. This thing mostly for diagnosing Whipple disease like Trophema and Whippi. and that mnemonic is pass the sugar. PAS means periodic acid skiffs, sugar means glycogen. Next one you can see like Gihel-Nielsen stain, that is like acid fast stain. So what does it detect means, it will detect acid fast bacteria, like acid fast organisms. We can use like carbonyl fusion, and mechanism will be like organisms with mycolic acid resistant and decolorization we can see. So what are the organisms we can see in Gihel-Nielsen stain means Mycobacterium tuberculosis, Mycobacterium leprae, and Nocardia. This Nocardia will be like very weak in acid fast stain. Next one Cryptosporidium oocyst. So in exam point of view, this is very important, that is auramine rhodamine stain. So auramine rhodamine stain will help to find out which organisms organism is sensitive or specific for using antibiotic. It will help, that is more sensitive or less specific and used for screening. Next we can see here, that is India ink stain. This India ink stain, mostly it will focus on capsule. It will show the capsule. If you are seeing this image here, this is the, it's showing Cryptococcus neoformans. If you are seeing here, that is clear halo around yeast, you can see here, that is like dark background. So in alternative stain we can do like mucicarmine or it capsule the stains red in color. Next we can see silver stain. In silver stain mostly like fungi and some for finding some bacteria. So what are the organisms we can see here means, that is Pneumocystis gyrovesi, coccidioids and Legionella, and H. pylori means Helicobacter pylori. So this stain, silver stain we are using when gram stain is fails. Okay. So next one we can see like fluorescent antibody. So in fluorescent antibody we can see like antibody tagged with fluorescent dye, and we can see some organisms glows under the ultraviolet. You can see here, this is the things, it will glow under the ultraviolet. For example, we can see like fluorescent antibodies like for syphilis like treponema and palladium. Okay. So these are the things. If you are seeing here in Giemsa stain, you can see some purple color microorganisms. So based on this thing we can easily find out that organism. So next one, that one like periodic acid skiff stain, if you are doing means, here we can find out some structures. So based on the structures easily we can differentiate that condition, like in Whipple disease. Next stain we can see here, that is Mycobacteria. When we are doing acid fast stain, you can see this type of Mycobacterium. Next I already explained about that Indian ink. Next one in silver stain we can see like coccidioids. Here you can see some arrow mark. Okay. So these are the things. So in summary, today we discussed about some stains and what are the organisms causing. For example, gram stain. Most bacteria, first of all, that is the first test, that is gram stain. Next in Giemsa stain we can find that organisms like Plasmodium and Chlamydia. And PAS, in PAS stain we can diagnose the Whipple disease. And Gihel-Nielsen stain, that is for finding tuberculosis. Indian ink for Cryptococcus organisms. Then silver stain, if gram stain is failed, then we have to do silver stain. In silver stain we can find out organism like pneumocystis. Next one fluorescent antibody for finding syphilis problem. Okay. So these are the things. So here if you remember why a stain works, you will never forget what organism it detects. Okay, so that's why this staining process is very important. So if you didn't subscribe my channel, like, share and subscribe. We will meet in our next video. Till that time, take care. Bye bye.